Last time on our journey, Pete Pays Too Much learned that it is important to incent innovation and promote competition.
Gee, Professor, I understand now how drug prices incent innovation, but I heard that government funds the research. Is that true?
Pete, that's a great question. The answer is yes and no. Come with me. There are two types of research. The first is called basic research. It's more general, aimed at discovering new scientific knowledge. Think of it as the starting point of a relay race to find new cures and treatments for illnesses like Alzheimer's disease. Without it, you wouldn't be able to run the other legs of the journey and finish the race to develop a new medicine. And you're right, Pete. The government pays for some, but not all, of this non-commercial research to the tune of $37 billion a year.
Professor, if the government doesn't fund all basic research, then who pays for the rest?
There are several other runners who may also run the first leg of this relay race. Private sector companies, public and private universities with strong research departments, and private foundations.
Professor, you said there's another type of research. What's that?
Once the first runner has finished their leg of the race, then it's time to pass the baton to the anchor leg runners, the private sector companies that conduct the applied research necessary to take a scientific concept and turn it into an actual therapy that treats patients. We conduct applied research to solve a specific medical problem for patients. Applied research builds on the knowledge learned in the basic research phase to develop potential treatments and learn whether a drug is effective and other important features, such as the side effects. Both legs are necessary to finish the race, developing new medicines that treat illnesses or create cures for devastating diseases. Nearly $100 billion is spent each year by biopharmaceutical companies to develop new drugs.
Gosh, that's a lot. What do we get for all of this spending, Professor?
Well, without this investment, the science would just collect dust on a shelf. Pete, your lesson for today is this. Government funds basic research, as it should. So does the private sector. But it's private companies that turn research from ideas on paper into medicines that help millions of people lead healthier lives.
Join us next time as we continue the journey to escape the drug pricing maze.